Correction of the open bite. With the example that I showed you during the insertion technique, we can control very easy the deep bites only by intruding the incisors, but also we can control very easy the open bites by the intrusion of the molars. And we use 2 microimplants in the labial area and a transpalatal bar separate to the palatal tissues to control the torque, and same in the lower arch, 2 microimplants in the labial side and a lingual arch separate to the alveolar margins and the teeth. So this is a case of first class with open bite. Initial records, and the treatment plan was intrude the molar and close the mouth. So first we have to use a TMJ splint to control the dysfunction of the articulations, and then disinfection, insertion of the right upper microimplant between the first and the second molar, diagnosis, anesthesia, mucosa thickness measurement, separation of the soft tissues, then indirect insertion technique, so perforating the cortical bone and the insertion of the microimplant. Control of stability and X-ray. In the left side, same diagnosis, anesthesia, and also the complete procedure with direct insertion. In the lower, same procedure with indirect insertion using a pilot drill, checking the stability with the tweezer and the X-ray, and also the insertion of the lower left microimplant. In this case, I inserted the 2 lower microimplants between the second bicuspid and the first molar. And it didn't work very well. Transpalatal bar to control the torque, and lingual buttons bonded to the upper incisors for myofunctional reeducation of the tongue, X-ray control, and in the lower lingual arch and 2 microimplants. Insertion of the molar directly from the microimplants, but the problem was the second lower molars didn't intrude because of the mesial position of the microimplant. So the progress was nice but not complete, and I have to change the position of the microimplant from mesial of the first molar to a position between the first and the second molar, and it is much better. So I fully recommend to use the microimplant between the first and the second molar. Also, you can use an elastic chain not only from the first molar but from the second molar to the implant and from the first molar to the implant in both upper and lower arches. So you can see how easy it is to close an anterior open bite by intruding the molar. And at the end of the treatment, final records, before and after, and 1 year later under retention. Other uses. There is a lot of examples where we can use microimplants, and probably we can use microimplant for a majority kind of cases. But in this case, she was a patient with agenesia of the upper right lateral incisors and also microdontia of the upper left lateral incisor. Treatment was opening the spaces for a veneer in the upper left and an implant in the upper right. Alignment and leveling. And then, when I had enough space, I put a temporary crown bonded to the lateral incisors and also to the central incisor. So, we will use a coil spring to distalize the upper cuspid and to mesialize the upper central incisor. Progress of the treatment. Coil spring. And then, when we had enough space, also we use a temporary bridge, like a plastic Maryland, to hold the space, as you can see here, close to the end of the treatment, and the end of the treatment. The problem in this case was she was a very young lady, so she had to wait more or less 2.5 years to be able to receive the implant here. And of course, we could have a lot of debonding accidents in this time. So, this is final records before and after. And I decide to hold the bone here and the space with a microimplant 10 millimeters, not completely inserted, to hold a temporary crown here until she's ready to receive the implant. Thank you very much, and I really hope that it will be very useful for your clinical practice.